You are listening to the Wholesome Way podcast, hosted by Alexander Lobb. Please keep in mind, everything shared in this podcast is for inspiration only and shouldn't be taken as medical or professional health advice. If you're making changes to your health routines or lifestyle, please check in with our qualified health professional first. This episode will begin in 30 to 60 seconds. During that time, you're going to hear a few words from two of our very generous sponsors of the show with some pretty awesome offers. So listen to this. And now, on with the episode. Welcome back to part 2 of why you can't eliminate stress and what to do instead with Dr. Gary Sprouse. Our conversation last week was so riveting and deep, and we just touched the tip of the iceberg. So here we are, part 2 on, and we're going to talk about addiction because Dr. Gary Sprouse has been doing a lot of work on that recently and came across a methodology around how to address addiction in the book In the Realm of Hungry Ghosts. Mm-hmm. So we're going to sort of do a discussion of that and how addiction is affecting people in the world. And I imagine there's going to be some connection, some two-way connection with stress in this topic. So it'll be good to see the connection, the relationship, the correlations between those. And but Gary, let's start with what piqued your interest in around addiction recently. It's a big thing in the world. Obviously, we see fentanyl in the headlines. These days, terrible stories of addiction. But what piqued your interest?
So a couple things. So as a primary care doctor in our country, in the United States, they started allowing us to prescribe Suboxone, and so Suboxone gets used to help people get off their heroin or whatever narcotic they're on, or the opioid they're on. And so I got certified to do that. And so I was taking care of 100 patients with heroin addiction. And then my wife and I bought an old hotel in our local area, and it was literally falling down. Like it was being held up by 2x4s. The city was getting ready to tear it down because it was just an eyesore. It had been the jewel of the city. The town has like 2,500 people, so it's small. But that had been their jewel because it was a hotel that was on their river, and the railroad tracks used to come there and drop people off. But the railroad tracks long ago went away, and so nobody could make it run as a hotel. So literally had been sitting vacant for 6 years. So we were like, this would be a perfect place to have a safe place for people that are trying to not rehab. So going from jail or rehab back to regular life, this would be the transition. So that's what we opened up, and we renovated it, and it became perfect because in most of the recovery residents that we see in our country, it's a 3-bedroom house where they stick 10 to 12 guys or 10 to 12 women. And you're like, a 3-bedroom house is not designed for 12 adults to live in, particularly if they have to have group meetings and things like that. So everybody's always squished, but this was a hotel. It was 8,500 square feet, and they had a bathroom for every 2 people. So it was like, this was perfect. So it worked out really well. And it worked out so well that somebody came to us and said, hey, you guys are at the basic level. I want to take it up to the next level. And so then he bought it from us and took it to the next level. And then 2 years later, somebody bought it from him and took it up to the highest level. And you're like, so now the town's all happy because now somebody's, the building's renovated, looks great. And now they got a business that's paying them their taxes and all these people. Because the original complaint was, well, we don't want all these drug addicts hanging around our area. And I'm like, you already have drug addicts hanging around your area. And these aren't drug addicts. These are people who are trying to not be drug addicts. So no, this is a good thing. So so they got over their initial concern. And we knew we were doing a good job. And we'd been open for 6 months. And somebody from the town came by and saw my wife. She said, so when are you guys opening? And she's like, we've been open for 6 months. And we're like, oh yeah, see, this is what we thought, right? You didn't even know we were open. That's how good this was, right? So so that was my experience. And second, and you mentioned this with the stress, as I'm doing all this work on stress, here's what I came to the realization. that everybody has stress, right? We already said that. And then everybody has a stress reducer. They pick something or multiple somethings to reduce their stress. So someone asked me, what do you do to reduce your stress? I'm like, well, I exercise, I read books, I do podcasts, right? I watch TV, I meditate, I go fish or whatever. So I have this whole list of things that I can do when I'm under stress. But then here's what I realized. If you pick a stress reducer, but the stress reducer starts causing stress, well, that's going to get you into trouble. So here's the line. Your stress reducer becomes your stress producer. Then you're in a stress reducer loop. So you end up in a loop. So here's the example I give people. So this guy's at work and he had a bad day at work. And he's like, ugh, bad day. I'm going to stop off at the bar on my way home and get a couple drinks, which he does. And the couple drinks relaxes me. Like, yeah, it wasn't that bad a day, right? So now he's driving home and a police pulls him over and gives him a DUI. So now he's got a driving under the influence, and his stress reducer, the alcohol, just produced stress by getting him a DUI. So then he goes home and he tells his wife, honey, I can't believe this. I had a bad day at work and had a couple drinks, and then I got a DUI. And she's like, oh my God, that's horrible. He goes, yeah, I'm going to go get something to drink. And she's like, what the hell are you talking about? What? And because that's a stress reducer, so now it's causing more stress because now his wife's yelling at him and screaming at him. And it's like, so his stress reducer is producing stress. And so what I've seen then is anybody can end up in a stress reducer loop because of all the different things that we use to reduce stress. Any one of them can be any one of the stress reducers can turn into a loop. So as an example, I was doing a podcast with somebody else talking about this, and she looked at me with this eye that she goes, oh yeah, I get this. I'm like, what's up? She goes, well, when I was a teenager, I would read incessantly. Like I would just read all the time. Like I was staying up all night to read a book so that I was groggy the next day when I tried to go to school. My mom's complaining that I don't go outside. My friends are like, when are you going to come play with us? She's like, I'm reading a book. And she realized that reading a book had gotten to the point where it was producing stress in her life as opposed to just reducing it. And so when she got to college, what she said is she had to read a book to take a test or something. And she lost the joy of reading a book because it was now it was a chore. And so she stopped doing it, right? So she got out of that loop. The guy in this book I was talking about, The Hungry Ghost, he had an addiction to CDs of classical music. And you're like, wait, what? So here's a physician, and here's what he's doing. At lunchtime, and he takes off to go to this store to buy CDs. And he's there for an hour and a half. He's buying $1,000 worth of classical music CDs that he already has, like it's Beethoven's Fifth, that she already has 5 different versions of it. He's buying a 6th. And then he's getting back to the office, and he's now an hour late. So all the patients are freaking out, and the staff's really upset. And then he's lying to them going, oh, well, I had this happen and I couldn't do that, because he's not willing to tell them I was at a CD store buying stuff. And it's like, then he gets home and his wife's like, hey, we just got this bill for $1,000. What's that about? And she's like, oh, well, And what he realized was that his stress reducer, buying the CDs and listening to them, is now causing problems. And so that's why he called it an addiction. But what I'm saying is, for most people, that doesn't even make sense. So at some point, he goes to an AA meeting, and he's kind of embarrassed for 2 reasons. One, because he has this thing with CDs. But 2, he's like, here's these people talking about alcohol and cocaine and heroin and how it's ruining their lives. And he's going to talk about a CD. And he's like, yeah, wait, what? So he doesn't actually talk about it, but he realizes that the process that he went through to get into trouble is the same process that everybody goes through that ends up with a problem. And so that's why. So what I found was that when I started working on stress and where it was coming from, and I got to the point where like, oh man, well, if all the stresses are coming from side effects to our skills, and we have to do something to reduce our stress. Oh, but the thing we picked to reduce our stress is now causing stress. Oh, that's an issue. And what I've been finding is that people that are in the stress reducer loop can get to the point where they're desperate and they go, oh, I need to do something about this. So people that I've found that are under stress go, I don't like it, but well, whatever, it is what it is. When people who are in stress reducer loops, they're going, no, this can't be. I got to get out of this and stop, because this isn't working. And so that's why I've shifted. And what I found was that under the stress reducer loop model, the way to get out of it is pretty straightforward. Here's the answer. Have less stress, so you don't need a treatment at all. And 2, find a different way to deal with the stresses you have. Find a different stress reducer. And then practice that till it becomes automatic. The end, right? That's all it takes. But that's not easy to do, right? So it's straightforward, but it's not easy. And so when I started looking at it that way, then I go, okay, well, I'm going to talk to people that have stress reducer loops. And under that umbrella, I can talk to them about how to have less stress. So I can talk about both issues under the same umbrella. And that's where I'm heading in this direction.
Gotcha. Yeah, there's more to, I guess, stress than meets the eye, that you've discovered, right? But how would you define addiction? Because, I think some people, are going about their daily lives. They're exhibiting stress, symptoms of stress. But is it possible for someone to be addicted to something and not be aware of it? Or is addiction that is the definition of addiction something where you're aware of it, but you continue to do it?
Well, all of the above, right? So I'll give an example. So we had a person that I knew, and he was drinking a lot of alcohol, and he was having tremors. And I was like, I think, he came to me and I said, I think your tremors are due to alcohol. Maybe you should cut back or stop and see what happens. He goes, no. This isn't alcohol. This is Parkinson's. And I'm like, yeah, I don't think so. And he's like, no, I'm going to see the neurologist and he's going to tell me it's Parkinson's and we're going to fix it. And then he saw the neurologist who didn't think it was Parkinson's. So he's like, well, I think it's one of my medications. So I'm going to stop that medicine because I think that's what's causing the problem. I'm like, well, okay, but I don't think that's what's causing the problem. Maybe you should just try and cut back on your alcohol and see what happens, right? Well, anyway, he ended up getting arrested, and then he couldn't get alcohol for a month. And guess what? Yeah, his tremor went away. And so now he can't ignore the fact that alcohol was causing the problem. So now he's got insight. So in the treatment program that I have, I call it WINS. That's my treatment regimen. So WINS is I'm going to give you some wisdom, like how your brain works, how habits work. I'm going to give you some insight because most people don't realize, or I don't know if most, but a lot of people don't realize what the side effects are to what they're doing. So this guy didn't realize his tremor was coming from alcohol. And then the N is for a new track. So it's a new treatment, a new pattern to use to reduce your stress. And then the last is a safe place to practice it till you can make it automatic. And so that becomes the treatment model that I'm going to use. So like in that guy's case, he needed the insight, but for him, it took him 30 days in jail to figure out, oh, maybe it's the alcohol that's doing it. I had another patient who was a smoker, and we were talking, and she goes, yeah, I don't think I should be smoking, but it's really hard to stop, blah, 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 blah. And so I go, oh, okay. She goes, I said, do you have any family members? She goes, yeah, I got a sister out in California. And I was like, well, when last time you saw her? She said, I don't know, about 6 years ago. I'm like, well, that's a long time. Why did you fly out there? She goes, oh, I can't fly. I'm like, well, why not? She goes, I can't go without a cigarette for 6 hours. That would be crazy. And I'm like, wait, what? What did you just say? I said, let me give you some insight here. You're telling me that one of the side effects of your cigarette smoking is that you don't get to see your sister. And she went, whoa, right. I hadn't thought about it like that. Yeah, that's kind of crazy. Yeah, no, that's not a good idea, is it? And then she was willing to stop, right? So yes, so a lot of times people don't realize, or they don't put it together. So here's my other one. So like a guy will come to me and I go, how much are you drinking? And he's drinking a fifth a day or something. Like, why do you drink so much? He goes, I drink because my wife's a bitch. And I'm like, okay, maybe your wife's a bitch because you drink so much, right? And then so like, they get there's a correlation, but not the right way, right? So that's
the cause and effect. Yeah.
Yeah. The second is most people will think addiction means heroin or cocaine or alcohol or cigarettes or maybe gambling. But in my model, it can be anything. So somebody who's reading a book, somebody like one of my patients came in and she was using heroin, and I'm explaining her stress reducer loops, and she goes, my sister's in a loop. And I go, what loop is she in? She goes, when she's upset, she goes shopping. And I go, yeah. And I say, she comes home and her husband's yelling at her because the closet is full and her credit cards are maxed out, which stresses her out, which then she goes back shopping, right? I'm like, yes, that's exactly what I'm talking about. So in this model, anything that you do to reduce your stress can become a stress reducer, and anybody can end up in a stress reducer loop. So what that does then is it changes the stigma that comes. So like somebody might have picked heroin, or I picked chocolate, right? So like I'm trying to lose weight and I'm tired and I'm exhausted, I'm stressed out, and my car just drives into the convenience store and I'm buying chocolate and it's in my mouth, and I'm like, wait, how did that get there? Wait, I don't remember. Wait, what? Right? I'm trying to lose weight. Where did that come from? Right? So it's the same process. So in what I've seen in addiction treatment, we call it a disease. And we say to people, like, you have this disease and the best you're going to do is control it. And you're going to have to work at this for the rest of your life. And you're like, okay. But in this model, what it says is you have stress like everybody else. You found a stress reducer that worked like everybody else. Then it became an automatic track in your brain. It's an anatomical neuronal connections that when the trigger goes off, you're like, go do that like everybody else. And then you realize this thing's causing problems. I need to stop. But then you're stuck because you got this track in your brain. You got all this extra stress from the loop that you're in. And with a lot of these chemicals, you have withdrawal, which then keeps you stuck where you're at. So when I took care of 100 patients that were having problems with heroin, like 95% of them, when they were doing their heroin, didn't do it because they liked it. They did it because they didn't want to go into withdrawal. And you're like, well, that's kind of crazy. So you're not even getting any stress reduction out of this. All you're getting is knock on into withdrawal. So that's why Suboxone works so well, because when I gave them Suboxone, then they weren't getting high because they didn't care about getting high at this point, but they weren't going into withdrawal either. And they weren't doing something illegal, and they weren't dealing with illegal things, and they knew exactly what they were getting. So the side effects went from way up here, lethal side effect, to way down here, but they weren't zero side effects. Like they still had to get the insurance to pay, make sure the pharmacist had it, and come to me and get a prescription and to find it and take it twice a day, blah, 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 right? So what I would say to them is, look, Suboxone is going to be it's going to be a transition. So you're going to go from heroin to Suboxone, but then we're going to go from Suboxone to you're going to have stress reducing tools that you won't have the same amount of stress. And we're going to find other ways for you to deal with your stresses so that you don't have to use that. And then we're going to take you off to Suboxone. So, and then here's in my office, this is what I tell people, like I was getting a 95% success rate.
I was just about to ask you what the success rate was. Yeah, that's pretty amazing.
Right? It was higher than that, but I can't say that because then people would go, no, there's no way, right? Because here's how I would say to people, how many times did you use heroin the year before you met me? And they go 365. I go, how many times have you used it since you've met me? And that might be anywhere from a couple months to a couple years, right? And it got down to out of the 10,000 days that I was where they were under my care, that only 60 days had somebody use something. So that was like 99.999%, right? But it's like, I just say 95 because that's at least a little bit more believable. But the question, so I told this to a guy who was a clinician that, was an addiction specialist. And he's like, yeah, well, whatever. I'm like, what do you mean, whatever? Like, seriously? You guys are getting a 20% success rate. You guys are approving $1,000 a month treatments because they have a 40% success rate. And I'm telling you, I got a 95 and you're not curious as what was going on? He goes, yeah, it was probably something you were doing. You picked a certain population or something you did that isn't transmissible to other clinicians. And I'm like, well, okay, I'm going to challenge you. Don't you think we should study this? Let's do a study. You have the money and the resource. Let's get together and do a study and let's prove or disprove that this is going to work. Yeah. And goes, haven't heard them back from him yet. Right. And it got so bad. This is how bad it got so bad that my board that licenses me, they wrote me a letter and say, we don't like what you're doing. We're going to take your ability to do this away. And I'm like, but I'm getting a 95% success. And they're like, we don't care. We don't like what you're doing. So you can't do it anymore. So they took away my license to write for Suboxone. So I couldn't do it anymore. So I haven't been able to,
that's crazy.
It's pretty crazy. And the reasons they came up with were even crazier. Like Yeah.
That's those sort of reasons that don't make sense, right? Logically.
There's a lot of things my board does to me that doesn't make sense, but I will say this. So the board, this was at a time when they were deciding that doctors were making all these people addicts. And you're like, yeah, no, that's not what happens. So people that have, so I was also, not only was I taking care of 100 people that had heroin problems, I was also taking care of like 250 people with chronic pain. So I'm getting some people off opioids because they were in trouble from it. And I'm putting other people on it because that's what gets them so they can function in their life. And so the board was like, no. And they were under a pressure because there was all this evidence, which has turned out not to be accurate, that it was prescription medicines that were getting people into trouble. And I'm like, no, because a person who's in chronic pain, they want an opioid to control their pain because that is the best medicine with the most convenience that's available. And it makes their pain so they can function. And I'm like, so if I give them too much and they start acting dopey, they go, doc, nah, that's too much, cut it back. The person who has problems with heroin is going, oh, that's what I'm looking for. I'm looking for that dopey feeling. So I need to take more and more and more to get that dopey feeling. And they get to the point where they take so much that it cuts out the respiratory center. And then that's how they end up overdosing because they don't breathe. They just stop breathing. So I'm like, these are totally different patients. But the board and a lot of society has lumped them together. They're just opioid takers. And then they just lump everybody together. And I'm like, it's such a disservice to both kinds of patients because people that are having problems with heroin have a whole different set of problems. And people who have chronic pain, that's not their problem. They just want their pain to go away. If I could make their pain go away, they would stop the medicine in a heartbeat.
Yeah, it's like nothing's black and white, right? There are patients with specific needs, specific, requirements, and yeah, the society loves to just lump people into baskets. And
they did, right? And then here's the worst part.
And then they suffer because of it. Yeah.
Yeah, it also lumped in hospice patients. So hospice patients 10 years ago, nobody cared how much opiate they took because they were going to die. And now they're lumped into the same basket. So now they're like, oh, well, I know you're dying and you're in pain, but we're not going to give you too much because we don't want you to get in trouble. Well, what trouble do you think I'm going to get to in 6 months? Come on, give me a break. Seriously, I'm hurting and I'm dying anyway. So let me die in comfort. They're like, no, we don't want. And what it came down to was doctors didn't want to get in trouble. So they weren't willing to write it because they saw what happened to me. And they're like, yeah, we don't want what happened to Sprouse happen to me. No, I think we just won't do that.
Wow.
Yeah.
So in terms of, addiction, what did you see was in the, the 95 success rate? Was it purely just down to, that switch to, so I've forgotten the drug again.
Suboxone.
Suboxone. Yeah. Suboxone. What were the other tools that you gave them? You mentioned your WINS process in the new track. Yeah. What did that sort of look like? If you can elaborate on those techniques.
So this is where that other book called The Real You comes in. So when I'm looking at stress, I'm like, okay, so what stresses are you under? And what you find with people that have really bad stress reducer loops is like a significant amount of them had some trauma in their life, mostly as kids, but somewhere along their life, they'd gotten raped, they were abused by their grandfather, they were, whatever happened to them. Like one of my patients had his two cousins had died when they were 6 and 8, and he was 6 at the time, and they died in a fire. And it's like that traumatized him. And so that put him so what happens is then those memories, it's not what happens to him, it's how they process the information. So in his head, he was responsible for why they died. So that gave him this incredible amount of guilt. And at the same time, his parents got divorced. And again, this was his fault. So now from 6 on, he's blaming himself for his parents getting divorced and his cousins dying. So then you have to do something that causes crazy amount of stress. So you have to do something. Well, as a 6-year-old, what the heck are you going to do? I don't know. So I've had patients that are sucking their thumb. I had a lady who would bang her head against the wall. They would play with, they would have their teddy bear or their blanket, whatever a kid could come up with. Maybe they become a bully, whatever. They come up with something. And then as they get older, they're like, whoa, hey, cigarettes would work for that. Wait, Like, how about alcohol? Ooh, marijuana. That may. And then what they find is they do marijuana, like, well, that helped, but not enough. So like, here's one of my patients. She thought she was normal. Okay. So she's riding horses and she's 14 and she falls off the horse and breaks both her legs. So she's in horrible pain. And the doctor puts her on an opioid pain medicine to control her pain. And she takes the first dose. She's like, oh, whoa. She goes, I didn't realize how anxious I was till I had taken the medicine and took the anxiety away. It was just part of who I was. So when it went away, I was like, whoa, that's a nice thing, right? So then she ended up taking that medicine for 2 years not because so much that she was in pain, but because it relieved her anxiety, right? But at 2 years, the doctor—
Oh, wow. So the anxiety was separate to obviously the breaking her legs incident.
Yeah.
Like this, you're talking about like regular anxiety about whatever.
Yeah, right. She had anxiety her whole life and didn't know it because that was just her normal. So when the medicine took it away, she was like, whoa, I want that. So she took the medicine for 2 years. And then the doctor brought her in the office and said, I don't like why you're taking this medicine. You can't be in pain anymore. So I'm just cutting you off. So of course, then she goes into withdrawal and she gets more anxious again because now she doesn't have the medicine that was treating her anxiety. So this is where the bad part comes in. So her dad comes along and says, oh, I can fix that for you, honey. And he gave her a shot of heroin.
Oh, no.
So then she becomes a heroin addict. And it's like, okay, thanks, Dad. Right. But I mean, here's the problem. So heroin works. It does what it's supposed to do. It took her anxiety away. It didn't have a lot of side effects. It was a pill. She knew what she was getting. The pharmacist gave it to her, so it wasn't tainted with something else like fentanyl or whatever else. And insurance paid for it. So what a great treatment, right? So the side effects from opioids are not the medicine. So in this book, the guy writes, there's a guy in America named Holstead, and his name is in Johns Hopkins, which is one of our big hospitals here. His name is on one of the buildings because he's considered the father of surgery in America. Well, it turns out that he used morphine every day for 40 years.
Really?
Yeah. So, but he didn't use too much, right? He just used enough to keep himself calm, to keep whatever anxiety he had going on, keep him from going on the draw. So for 40 years, here's a guy who's using this medicine that isn't giving him any side effects. And he becomes like one of the greatest surgeons we ever have in our history, right? But then other people, and this is where they get into trouble, is it's not cheap anymore. So now if you want heroin, it's not 5 cents or 10 cents. It's $50 for a little bit. And you're like, why not $50? And you're like, well, find it. So then what you see is people are stealing, people are prostituting themselves out. They're doing whatever they can to find that $50 because, like, dude, I don't want to go into withdrawal because that sucks. And I don't want to feel all that pain that I've had from whatever their pain's coming from. And so this is where my model of stress reduction comes in, because what I say is, look, stresses come from your past, they come from your present, and they come from your future. And so you have to be able to figure out how to deal with these. And so your past is because you have a really good memory. Your present is because you're doing a stress reducer loop. So you're going to end up increasing your stresses all the time. And it's like, and then the future is you're worried about this and worried about that. So what the WINS model then says is, here's where stresses are coming from. And here's all these separate techniques for how to change the ones from the past, how to change ones in the present, how to change ones in the future. So that when you lower the amount of stress, then you don't need any treatment. So here's the example I use. So if you were 400 pounds and you came to me and said, Doc, I'm a diabetic, can you help me? I'm like, sure, I can give you all kinds of medicine. I can give you insulin. We'll do this, we'll do that. We'll get that sugar down. But if he came to me and I said, yeah, let's get you to lose 200 pounds, guess what? Then your diabetes goes away and you don't need anything. So what I'm finding with stress reducer loops is if I get rid of enough of your stress, then you don't need any treatment. And whatever treatment you need, you don't have to do it so often or with such intensity. So like for me, I'll use myself as an example. So my family, my father in particular, had a significant alcohol problem. Anyway, I won't go into all the details, but basically had a big problem with alcohol. And so you would think for me being a son that I would be at risk, right? But I don't have any problems with that. I'll drink a beer here and there, but I don't if I drink one beer, I have to drink 50 beers, right? It's like, I'm drinking a beer when I go sing karaoke, I'll drink a couple beers. It helps loosen up my vocal cords.
That's right.
Right. But then I stop because I'm like, that's enough. I don't need any more. Right. So what was the difference between what my dad was doing or what I'm doing? Right. And I'm not 100% sure, but it has to do with the stresses that he was feeling. So if he was under a lot of pressure, so here's this guy, he got married when he's 20. He was sick as a kid and had a whole bunch of issues that he had to deal with. He wanted to go to higher levels, but he couldn't because of this thing. And then he has 5 kids he's got to take care of and a wife that he, whatever he liked, didn't like, whatever. And it's like, that's a lot of pressure on somebody. And so alcohol became his pressure release. And then it became the habit. So then he couldn't get out of it. And if he stopped drinking, then he felt like crap. And so then he just kept drinking to the point where it got him in so much trouble that he finally said, you know what, I got to stop. And he did later on in his life. And he didn't drink, the last 10, 15 years of his life. But I've never, so because I've read my book, I don't have the same kind of stresses that he had. Like I have some of the same things in my environment. I ran my own business for 38 years like he did. I only had 2 kids, not 5, right? But I had a wife, had to go through divorce, I had all this crap with my board. So I have, and just being a doctor, you're dealing with people's life and death decisions, you're dealing with malpractice and all kinds of crap, right? So I had a ton of stress, but because I was able to handle my stress more efficiently and effectively, I didn't need alcohol all the time to keep it under control. I didn't need, so like I see patients and this, they call marijuana a gateway drug. I'm like, no, it's not a gateway drug. It's not effective. It's not working. Like whatever they got going on, it isn't enough. So they're doing marijuana and somebody goes, well, try heroin. Like, whoa, that was way better. Yeah, let me go to heroin because that worked, right? So if somebody did marijuana, like, yeah, I'm not doing heroin. What the heck? No way. I'm just my marijuana is good enough for me, right? So you see, the more stress you're under, the stronger the stress reducer has to be, and the more often you have to do it. So it makes it more likely for you to get into trouble.
That's a good point. What's from all the patients you've seen and you've cared for and succeeded, what's like the number one best step in your opinion that someone could do to stop this addiction and handle the stress at the same time?
Okay, so the first thing that I think people have to do is what we talked about earlier, is they have to recognize that the thing they're doing is causing stress. And what's happened in the past is that like if somebody came, like I don't know if we talked about this story, but I worked at a nursing home and a guy who was like 60 some years old came in because he had pneumonia. He was really weak. So he came there to get strong. So he comes in, he's just trying to get some rehab. And his doctor walks in and says, Bill, you're an alcoholic. And Bill's like, wait, what are you talking about? I'm just here to get rehab. He goes, no, you're an alcoholic. I looked at your ER record and you drink 4 drinks a night, every night. That makes you an alcoholic. And he's like, what are you talking about? He goes, yeah, I have 4 drinks a night, but like I work, I'm a therapist and I haven't missed a day of work and my wife doesn't complain and I don't drive when I'm drinking. So I don't have any DUIs. What the hell are you talking about? He goes, no, you're just in denial. You have, and this is what we imply, you have alcoholism, which that means you have a disease that's forever and there's nothing you can do to get rid of it. You can't cure it. The best you can do is control it. And, you're weak-willed and you're stupid and your brain probably has some damage and you have a personality. These are all the things that we apply to people who have addiction.
Whoa.
Which then this guy sitting there talking to his doctor going, wait, so the doctor's gone, you have alcoholism. But what the patient's actually hearing is like, wait, so I have a lifelong disease that I can't cure and that I have brain damage and genetic defects and I'm a personality, What? No. So then they argue with you and they go, man. And what he did was he fired the doctor. Get out of my room. I don't want you anymore. So even if that guy was having problems with alcohol, the way we approach the problem turns people off. They're like, I don't want that. No, forget it. So the only time they're willing to admit it is when they get to the bottom and they go, I'm in the worst place I've ever been in my whole life. Fine. All right, I'll admit it. I got a problem. I got to do something about it. Because then it's worth it when you're at the bottom. Like I had a guy who had a gun in his mouth. And he's like, wait, why don't I just stop drinking? And you're like, yeah. So he took the gun out of his mouth and stopped drinking. And you're like, yeah, that was a way better answer, right? But he had to get to that point to say, okay, I got to do this. So the first thing to say is what this model, my model, the stress reducer loop model says, you are not diseased. You don't have an incurable disease. What you have is you have stress, and the treatment that you found for it is causing problems. That's it. So if I just change the treatment or I get rid of the stress, problem gone. So when we have people that we go, hey, I'm Bill, I'm an alcoholic. And when's the last time you drank? Well, like 20 years ago. Well, then why are you identifying yourself as something you haven't done in 20 years? That's what? And the answer is, well, I have to remind myself that this is an incurable disease. And so I got to keep reminding myself that I'm an alcoholic, because if I just drink one drink, I'll be back on. And I'm like, okay, so you have literally thousands of tracks in your head. So stop naming yourself for the one of them. You can go, hey, guess what? I got a track in my head that says if I drink alcohol, I'm going to be back into trouble. Fine, but you don't have to label yourself. And I would say to patients, well, here's my example of how stupid this sounds. I go, yeah, I'm Dr. Sprouse. I'm a bedwetter. And they go, what? And I go, well, I haven't wet the bed in 60 years, but all it's going to take is one night and I'm wetting the bed again, right? And you're like, that's stupid, right? Again, yes, it's stupid. Right? I don't do that anymore. So I don't label myself as a bedwetter. So what I find then is under the disease model, we're labeling these people forever with this horrible, stigmatizing, ostracizing, bad label. So I'm like, nah, stop that. So when you use the stress reducer loop model, what you say is, hey, you're in a loop. Okay, what's that? And you're like, okay, it's this. And you're like, okay. And when you don't do that anymore, then you're not in the loop. You're out. That's the group that I'm starting is called Loop Breakers, because my job is to break your loop. Let's get out of the loop. And then you're not in anything. You're just a person. How freaking nice is that?
I like that, Loop Breakers.
Yeah. So what you see then is so the first step is identifying that you're in a loop, because that's where a lot of people get, they miss the signals. They don't get it, or they don't want to get it, whichever, right? The second step is, and this is something I've learned recently, which is a lot of people will go, hey, I'm interested in that. That's pretty kind of cool. But then there's other people who go, they're committed. So interested versus committed. So interest, like, yeah, okay, sure, that sounds interesting. And you go, well, you got to do something hard. Like, I don't know, I'm not that interested. Like, I don't want to spend that much money. I don't want to spend that much time. I don't want to do whatever, right? Committed is like, oh, dude, this has to happen. So I don't care what it takes. We're going to do this, right? So what we have to do is get people to go from like not even knowing they're in trouble to, okay, I'm interested, to, okay, I'm committed and I got to do something about this. And that's actually a tricky process, because it has to be internal. Like the person has to do it themselves. Like you can't make somebody not be in a stress reducer loop, because they'll just find, if you take away their alcohol, they'll find something else to do. Right. So they'll eat more, or they'll go start gambling, or whatever, because if you're not taking care of the stress that's underneath of all this, it's just going to pop its head out somewhere else.
Yeah, totally.
Yeah. So once the person figures it out, then you go, okay, once they get committed, now you're like, okay, now you're committed. So now here's the work we're going to have to do to get there. And so I'm trying to figure this out, because I have so much information that is in my head that I want to get into their head, but I don't know how to organize it yet. Like that's what I'm working on, is I know what I want to tell them and what I want to teach them and the insights I want to give them, but what's the most effective way to teach them this stuff. And I actually say to people, look, I can teach you out of being in a stress reducer loop. Like it's no magic to it. Like anybody can do this, but there's some stuff you have to do. And so this is where the other book, The Real You, comes in. So what he says is that we have these beliefs that are in our head. And we have, I believe that, the United States is going to be this, or, I think Australia is that, or whatever. You got like kangaroos are a menace, and for the United States, kangaroos are cute. For Australians, they're like, what the heck? Get out of the road. You're messing me up here, right? Right. Is that right? That's correct, isn't it?
People who live in the country, yeah. But us
like,
city folks, we love seeing kangaroos.
Yeah. Anyway, so we have these beliefs in us, but they're what he calls our core beliefs. And these are beliefs that are at the base. So when we were talking last time about stratospheres, so stratospheres is built in layers. So these core beliefs are at the center. So in the center, it's like, do I believe in God or not? Because if you believe in God, then praying makes all the sense in the world. Because then you're like, well, I believe that prayer is going to work, but you have to believe that God exists before you're praying to God. Because if you don't believe in God, praying makes no sense, right? So when you look at these core beliefs, what are they? So the first one, I think, is whether you believe in God or not. And I don't care whether you do or not. I just need to know whether you do or not, because that changes how I handle you. Because if you believe in God, then I'm going to do this. If you don't believe in God, then I'm going to do that, right? Second core belief, self-esteem. And self-esteem comes in three parts. So it's self-worth, like how worthy am I? Self-respect, am I doing things the right way? And self-efficacy or confidence, like how will I do with a future problem that I have to deal with? And what I see is some people have pretty good self-efficacy. Like I met this guy who was an athlete, and I go, yeah, we got to work on your self-esteem, because I was still like figuring this out. And he goes, my self-esteem is fine. He goes, I think I'm a great guy. And if I am on an athletic field, dude, I'm taking care of anything. I'm good, right? And I go, yeah, but you're smoking cigarettes. Do you think you should be smoking? And he's like, yeah, no, we shouldn't be smoking. And you're like, yeah, okay. So your self-esteem is taking a hit under the self-respect category. The self-worth and the self-efficacy are you doing fine. That's self-respect. So what you see is when somebody stops their stress-reducing loop, they get their self-respect goes whoop, and they feel better about themselves. Right? For two reasons. One, because they've accomplished something, and that gives you self-esteem points. And two, because now they have more self-respect, because now they're doing things the right way. Right? So self-esteem becomes one, and that becomes one of the hardest ones to fix, because once you have this idea in your head, so like you have the belief, and in his book, he calls it enoughness. Like, I'm not enough. I'm not enough of this. I'm not smart enough. I'm not fast enough. I'm not whatever enough. So what happens is that becomes part of your identity.
Yeah.
So when someone comes to you and says, hey, Alexander, I think you're a really great guy, and you think your self-esteem is, you're like, wait, what? So you're now like, no, that's causing dissonance. That's causing conflict. That doesn't fit with what I think. So then you start modifying the information to fit what you think. You're like, dude, you don't know what you're talking about. Like, you don't know the real me. Like, what did you just say? No, come on, really? And so now you modify all the good information because it doesn't fit. But when someone comes along and says, you're a jerk, I hate your guts, you're like, I hate hearing that, but that fits. All right, fine, I'll take it. And that becomes evidence that you aren't enough. Like that guy said I wasn't enough. So if 10 guys say you're enough and one guy says you're not, you're ignoring the 10 and going, yeah, all right, I guess I'm not enough. And you're like, yeah. So it becomes hard to change because it's one of those core beliefs that most people don't even pay attention to. And most people, if you say to them, what's your self-esteem like, don't even know, because they're like, I don't know. I don't pay attention to that. And the problem with self-esteem is it gets started when you're a baby. Like the first time you figure out you're somebody different than your parents is when it starts. And self-esteem isn't self. Like for the first 5 years, it's what everybody else is telling you. And you're just sucking in the information like, okay, if that's what I am, right? And you're like, so if your parents are like, you snotty nose, like, okay. And I have like one of my patients, her parents had to get married because she got pregnant, right? So now the father and the mother are both gone, looking at the daughter who made them get married because the marriage was miserable, of course. And they're blaming her for why they're miserable. And so they're telling her she's a jerk and it wasn't for her. They wouldn't be like this, right? So that's what she's growing up with. So guess what she is as an adult, right? That screws up your head. It changes the anatomy, literally. So in the book, The Hungry Ghost, it changes the anatomy of your brain. But in this model that we're talking about, it changes your self-esteem and how you process the information. So now every time information comes in as an adult, it's filtering through that what you thought your self-esteem was. So if you can start changing that and get somebody to believe that they really are enough, well, then literally everything in the world changes. And I had this happen with a patient of mine. She had been drinking alcohol a lot. And I have this technique that I use. It's basically a point system for looking at your achievements and your traits. And what most people do is they don't keep track. They don't accurately. So they give themselves 1 for something good and 10 minus 10 for something bad. So it's hard to keep the ratio up, right? If you have to find 10 good things for every bad thing and you're paying attention to the bad, yeah, that's hard. So we went through this whole process and I'm patting myself on the back because I can see that we're like, oh, yeah, see, I'm showing you objectively why your self-esteem should be good. And I'm patting myself on the back on, yeah, I'm fixing this lady. This is good. And I look at her and you would have thought I punched her in the stomach. And I'm like, okay, well, let me take a step back here. What's going on? And she goes, well, if I'm wrong about myself, what else am I wrong about? And you're like, whoa, right. Because I was futzing around with one of those core beliefs that literally affects everything else in your life. So when you monkey around with somebody's core beliefs, they got to be willing to literally reprocess their memories and go, wait, remember that time? And that's, yeah. And when I'm gone in the future, yeah. So you're literally changing their view of the world by monkeying around with just one thing. It's only one thing. I'm a good person. I'm not a good person. That's it. But if you start monkeying around, it literally changes everything, which is why when people have their epiphanies and they believe in God, their world changes literally, because the way they see the world is now through a different, and the word I use is prism. They're looking through a different prism. And so it looks different. Their perceptions are literally all different. And so they have to go back and reprocess all this information. So self-esteem and self-enoughness is one of them. So then another one is feeling safe. Because if you grow up in a house where your mom's getting beat up all the time, you don't feel safe because you're like, well, all it's going to take is 1 minute where he's throwing something at her and misses and hits me, right? Or what's going to happen if mom gets killed? Or what's going to happen if dad gets so angry and he follows through with his threat to leave us? And right. So now all of a sudden you don't feel safe, which then makes you do things to try and feel safe. That's where the stress reducer loops come in, right? So, so safety is a big thing. I think that's actually a bigger problem because when people when they talk about wanting money, what I realize is it's not money that people want. And money doesn't necessarily buy happiness, but it does help, right? And it doesn't buy safety, but it definitely helps. So if the more money I have, the more safe I'm going to feel. So like I have, I'm retired, so I have some, a nest egg. So the stock market's gone up and down like crazy, right? And I'm like, well, it's okay because I got plenty of money. If I didn't have plenty of money, I'd be like, whoa, we just went up this and we didn't, right? I'm retired. I'm not making any more money. What? So money actually buys you safety. That's what it does buy you.
Yeah.
So safety is a big deal. And a lot of people, particularly from their childhood trauma, don't feel safe. And that's where they get into trouble. So when you can get them to feel safe and understand what safe means, then they can reduce their stress, right? Then the other ones are things like they see relationships not as pleasurable as painful. So I'm going to use my wife as an example. She's had 2 really good friends in her life, and both of them did mean things to her and left. So she's like, so for the last 5 or 10 years, she was like, I would say to her, hey, why don't you go out with one of your friends? She goes, I don't have any friends. And I'm like, what? What do you mean you have any friends? You have this person, that person. Like you talk to your sister like 5 times a week. She goes, she's my sister. That's not a friend. I'm like, well, you talk to this person. Like, well, she's not a friend. That's your friend. And I just I'm like, wait. So what she had done was made the definition of friend so skinny. That's the criteria. And so finally, after I read some books, and I said to her, honey, why are you afraid to say you have a friend? And that stoked something in her. And she realized that she had equated relationships with pain. And so
any relationship.
Well, yeah, particularly friend one. Yeah. So literally after we had that conversation, she now has a friend, right? So she went on a girls' weekend with the lady. She's coming to karaoke with us tonight. So it's like, yeah, so now she has a friend. And it's like, but she had to be willing to say that and change that idea in her head that relationships equal pain, not pleasure, right? So
yeah, wow.
And then, yeah. So those are the things. There's a couple other core beliefs in there, but I know we're running out of time. So but that's the idea. So if I can get people to change their core beliefs, and then so I talked to the guy who wrote this book, The Real You, about the core beliefs. And I said, you didn't talk about identity. And he talks about identity, but not as a core belief. So what he thinks is your identity is an accumulation of all those other core beliefs. And I'm like, yeah, no, I think identity is a whole separate core belief. Like who you believe you are might be based on the information from those other things, but it's separate. And it's and we do a lot to maintain that identity. So like I'm a doctor, right? And I'm like, yeah. So when people go, hey, who are you? I'm going, oh, I'm Dr. Sprouse. Like I'm telling my identity as a doctor. But when I was having problems with my board, they were trying to take my license away. And I'm like, wait, what? I'm like, so then all of a sudden I'm in an existential crisis going, well, if I'm not a doctor, what the hell am I? I don't know. I have to figure this out, which is why a lot of people, when they go into retirement, freak out because their identity got taken away because they're not an engineer anymore. They're not a pharmacist. They're not a doctor. They're not a lawyer. They're just a retired person. We're like, that's not an idea. Wait, what? So the good thing that came out of the problems I had with the board was that I had to reestablish my identities in other places. So my wife and I took some real estate courses and we became real estate investors. We became landlords. I became an author, right? So now I'm retired and I tell people I'm a doctor, but I don't care if they just go, hey, you're Doc, or if they just go, hey, Gary, and you're like, yeah, sure, whatever. I'm just Gary, right? But so I will tell you this. This is awesome. I loved it. So I met this guy a week before at a social gathering, and then I saw him a week later, and he goes, hey, I remember you. He goes, you're that author. I'm like, yes. Not because everybody else goes, you're the doctor, right? And like, yeah.
Huge win.
It's changing. Yeah, I'm an author now. Yeah, I like it, right? But identity becomes critical because you do stuff. So when I read books on how to change your habits, one of the things you change is your identity. Because if you go, I'm sitting on a couch watching TV and I want to start exercising, well, I'm a couch potato. Couch potatoes don't exercise. So when you become a jogger, what do joggers do? They jog. So when you're jogging, you're reinforcing that identity that you're a jogger. So then one day we don't feel like jogging, like, yeah, no, I'm a jogger, so I got to jog, right? So that identity reinforces the things that you want. So one of the things that I want to do in my WINS program, and my wife and I have been banging our heads together trying to figure out how do we change somebody's identity so we don't call them drug addicts. We don't call them ex-addicts. How do we change their identity to the new identity that they're now going to reinforce these new behaviors that they're making up, right? And we were like, hey, we'll cut their hair. We'll give them jewelry. We'll give them a tattoo. I don't know. But one of the books that I read gave me the answer. And the answer is you come up with a, what's the word I'm using? I'm sorry, I'm blanking on. So when a mascot, you come up with a mascot. That's the word I'm thinking, right? So, like if you go to school, your school has a mascot, right? You're the kangaroos, you're the roos, you're the lions, you're the tigers, you're the bears, whatever it is, right? So for a person, they can do the same thing. So that we go to them and go, tell me like an animal or a thing that you would want to be like, and you would want somebody to describe you as that, right? And they go, wow, I want to be a mountain lion because they're fast and they're silent and they're deadly. And that becomes their identity. So then you go, okay, Bill, mountain lion. Yeah. And he's like, and you can see, whoa, mountain lion. Yeah. That makes them feel good. Because if you go, hey, I'm Bill, I'm an alcoholic. What does that make you feel? That does not make you feel good. But if you go, I'm Bill the mountain lion. Yeah. That makes you feel good. And that becomes your identity. And that changes the core belief because now the information that's coming in is now being filtered through I'm a mountain lion. Yeah, that's a whole lot different.
Yeah, that's something that I've read in a book called Feel Good Productivity by Ali. His name's Ali. He's a doctor in the UK. And he talks about this this technique, very similar to what you said. It's called the Batman effect. I think he calls it the Batman effect.
Okay.
And a lot. Have you heard of it before?
No, I have not. But I'm guessing where you're going with this. But yeah.
Yeah, and it was fascinating. I've been using it on and off as well. It's mainly, he said, the use case for it is when you're feeling, like your self-esteem, your self-respect. You're not able to perform because you've got these sort of limiting beliefs about yourself. And actually, it turns out that a lot of actors, like famous actors, a lot of famous performers, singers, Adele, use this effect, and they basically create an alter ego of themselves in this sort of like, fantasy world where they step into this person when they go on stage, or step into this person when they pick up their guitar, because they're they're plagued by stage fright, for example. So I think Adele, I can't remember what they always give it a name. They give their alter ego a name, but Adele had it. Beyonce used it, and because, as you said, you're shifting your identity when it matters. When you really need it. To get out of addiction, to perform, to, I don't know, face the music on someone you have like a resentment with, or you have like some issues with your family. So yeah, I think you've really hit the nail on the head there with identity, and that it's not just about the job title. That's I think that's really
exactly.
that's really where people fail.
Yeah, and it's like. So I read this book called Family Systems, and he describes us as having basically we all have multiple personality syndrome. And I'm like, that's a little too far, right? Because he, in his therapy, actually talks to the other people in your head. And I'm like, yeah, that's taking things a little too far, right? Yeah. What I think is that, so I talk about a perspective prism, and this is the information that has your beliefs and your theories and your facts and your experiences that are in there. And then the information coming in goes through that prism and comes out as a perception. And what I think is people have more than one perspective prism. So if you're on stage, your perspective prism is this. If you're in the doctor's office, your perspective prism is that. So somebody asked me the other day, when you were a doctor, what'd you do when a beautiful woman came in and needed to be examined? And I'm like, well, because I got my doctor prism on, like it was just another patient. Like it's not something I hadn't seen before, right? Or just breasts or just bellies or whatever, right? When I'm a guy in a bar, I'm like, whoa, that girl's hot, right? So it's like, it's a whole different prism. So we all have different prisms in our head. So my only concern with that idea is if I just make a new prism and call it that, and I don't do something to fix what was in this prism, then I'm just covering up the problem. That's my concern.
Yeah, absolutely. Sense? Yeah, that totally makes sense. It's because
an
alter ego can be effective, right? Yeah.
No, I had a patient. She told me she was really introverted and shy, and I'm like, "What? You were an actress. You go on stage." She goes, "Yeah, but that's a different me." Same thing what you just said. Like that was literally a whole different person for her. So.
Yeah, definitely. And then you can kind of lose yourself because you end up confusing your identities. And your true, your true identity, right? Instead of using it, as you said, like prisms where you would, channel yourself through this certain prism, depending on the situation you're in. But then, if you lose touch and you're confused about who you are, then that becomes a problem. And then you might turn to addiction to deal with it, right? Because you're stressed.
A lot of, you got it. A lot of actors get into that problem.
Yeah.
Right. You've heard stories of actors who got so into their character that they couldn't get out of it, or it affected their relationship with their partner because they started doing things that their character did. They're like, I didn't marry that guy, I married you, right?
Robin Williams is an example.
Yeah. So the other thing that actors get into and actresses is that they are in such control of their emotions. It's phenomenal, right? They're the Olympic athletes of emotional control. And I say to my patients, look, you can control your emotion. Like, I don't know. I'm like, look, this actress can control emotions like amazing. I'm like, I don't need you to be that good, but you can do what she's doing you don't need to be that good. You don't need to be an Olympic athlete, right? You just need to be an emotional controller. But they get so good at it, then you can't trust them. And we use emotion as a big register of whether somebody's being real or not. So if you're going, I'm really upset. You're like, yeah, you're not upset. What the hell? Like you're smiling, you're laughing. That doesn't fit, right? Or I'm boo-hooing, and you're like, wait, why are you crying? You just, like, it's like, no, I'm not buying that, right? No, I'm not buying you the Mercedes Benz, right? I don't care how much you cry, right? So we use emotions as a meter of whether somebody's being honest with us or not. So when actors are so good at their emotional control, then the person doesn't know whether they're being honest or not. So that causes problems too. So.
Yeah, absolutely. And I love what you said before about, I think it's really important to not correctly use labels, to your benefit, like labels can be really destructive. And we see this, I'd love to get your take on this, because I've asked a couple of other doctors about this on the podcast, but especially around children, and how detrimental that can be when they are given a label. Like, I'd love to hear your take on, this, you could say, epidemic of depression. Like, what do you think about depression, and do you think that is really detrimental to tell a kid that they are diagnosed with this depression?
Yeah, no, well, so that's part of the book that I wrote. So what I found with most people who are getting diagnosed with depression, and you're like, so you have to keep in mind that doctors are trained in, let's get a bunch of symptoms, let's put them together and then call it something. And then we can treat the something. So we might not know what's causing high blood pressure, but we go, oh, we're going to define blood pressure by this. And then we're going to put you in this category. And then we're going to treat people with that number and see what happens to them. And if we leave the number alone, then they have heart attacks. If we treat the number and get it down, they have less heart attacks. All right, fine. But that's how we're trained. So depression becomes what we're trained. So we go, we're going to take these symptoms. So it's the symptoms of like, I don't care, I sleep too much, or I can't sleep, or I eat too much, or I don't eat, or I feel overwhelmed, or I just kind of tune out to the world. Like, or I don't like, I just don't enjoy anything anymore. So we take those symptoms and we give it a label and we call it depression. But there's no blood test that I'm going to do that says, oh yeah, you're depressed. Like a blood sugar, I can go, yeah, your blood sugar is 400, so you got diabetes. But with depression or with stress reducer loops, there's no blood test. There's no objective measure that says, oh, you have it. So we're now making stuff up. Like we're going, here's the symptoms and we're going to call it this. And then we're going to take people who have that label and treat them and see what they do. So we give them this medicine and we go, we know what the medicine does. It elevates serotonin level because we've done this in rats, right? And what we see with people that we give serotonin, they feel better. And you're like, so then we jump to the conclusion that they were serotonin deficient. And that's what caused their depression. That's what caused these symptoms. And now we fixed it because we fixed their serotonin. But that's wrong most of the time. So most of the people that have the symptoms of depression are really overwhelmed. They just got too much stuff. And so what happens is they got this and that and this and that. And they're like, oh my God. And when people get overwhelmed, guess what they do? They eat too much, or they don't eat, or they sleep too much, or they don't sleep. And they feel like they're overwhelmed. And they just get to some point where like, I'm just going to sit here and I don't know what to do, but I'm just going to sit here because I don't know where, like, this is where. So what I've done is said, no. And what happens is, like, if I take somebody who's depressed and I take him out to the bar and get him a couple drinks, guess what? They're not depressed. So are they alcohol deficient? No, they're all smiling, happy. They're like, oh, this is great. No, they're not alcohol deficient. I just gave them a drug that helped them make them feel better temporarily. But the next day, now in addition to all the other problems they have, now they got a hangover. So now their stress has got even worse, right? So what we see then is we treat people with a medication to fix their serotonin level. And they'll be better. They'll feel better. But then 6 months later, more things happen. And guess what? Now they're more depressed. So they need a higher dose, or they need a second medication, or and it's like, that's not that the problem is. So I had a patient that came and we went through this. Guy was like 80 years old and his wife was declining from dementia. And he came in, his kids brought him in. They go, we think dad's depressed. And I'm like, well, why do you think that? He's like, well, he's yelling at mom and he's this and he won't this and he can't sleep and he's always aggravated and irritated. Blah, blah, blah. And I'm talking to him and I'm like, dude, you're not depressed. You're overwhelmed. He goes, fine. That's what I thought. I'm not sad. I'm angry. Like, I'm losing my wife. I'm 80 years old. I can't do all the things I used to be able to do. So I'm losing all that too. So he was grieving and he was just overwhelmed because he didn't know how to fix his wife. He didn't know how to get his house taken care of. And he saw his own death coming sooner than later. And it's like, so when I said to him, you're overwhelmed, it was like, this whole weight went off his shoulder because he's like, yeah, I didn't think I was depressed. And so I said, look, I can give you some medicine that'll make you feel better for a couple months, but you're not serotonin deficient. You just need to get rid of some of these problems. And if I can make you feel better for a couple months so that you can then have the energy to fix the problems so that they're not there anymore, and then you won't be so overwhelmed, then let's try that. But it's not a lifelong medication. Yeah. But we don't need medicine. We just need to figure out ways to get rid of some of these problems. So,
yeah. Great stuff.
Did that answer the question?
It did. It did. Yeah, yeah, absolutely. I think
Well,
there's a lot, there's a lot to take away from this.
the
Yeah.
take on that is I think we way overdiagnosed depression.
Yeah.
And that really what we need to be doing is figuring out where these people's stresses are coming from and reduce their stresses. And then they won't be overwhelmed, and then they won't have those symptoms anymore.
Yeah. Totally agree. Totally agree. You focus on taking the bull by the horns and working out what the challenges are, what the problems are, rather than focusing on like, oh, this is depressing, this is what it is, and all of that. So I think and then labeling it and connecting it with your identity. That's where you go wrong, right? Because you've just been told that you have depression, and then that becomes part of your identity. So yes. I think yeah.
Well, and again, the same problem with when we say somebody has an addict, like that's a lifelong thing. That means my brain's not working right. That means I'm serotonin deficient, and the only way to fix that is to take a medicine that elevates my serotonin. That pharmaceutical companies love it. Doctors love it, because guess what? The patient has to come back every couple of months to get a prescription, right? So the economic system is set up to label them as depression because everybody makes money out of that. If I label as overwhelmed, then you don't need a medicine. You just need to fix the problems. And it's like, all of a sudden people don't make as much money anymore.
Yeah, there you go. Well, Gary, thanks for shedding so much light on the correlations and the nitty gritty about stress and addiction. It's been very fascinating, and I think, very useful. A lot of takeaways, from this episode. But very much looking forward to hearing about how the WINS program goes and the loop breakers. Yeah, yeah, it'll be cool to see how that goes. And if anyone is keen to follow Gary, Dr. Gary Sprouse, on his journey, the author.
The author. There you go.
Make sure you get a copy of his book, Highway to Your Happy Place. They got the audiobook as well on Amazon, so check that out. But Gary, thanks so much again for coming on. That was a really good conversation. Part 2.
Thank you so much for having me on here.
I
really appreciate this, and I really enjoyed this. I look forward to this. So this is good.
Yeah, it's good. And also have fun at karaoke tnight with your wife.
I know, right?
Uptown Funk coming in hot.
Yes, right. So people ask me, who's the better singer, you or your wife? And I go, oh, my wife's a way better singer, but I'm the better entertainer. So that's our labels, right? She's the singer, I'm the entertainer, right? So a couple of weeks ago, I came with a big wig on and had zebra skin platform shoes. Yeah.
You compliment each other well.
We do.
Good stuff. Well, thanks again, Gary, and all our listeners today. Please check out the links below, and please rate the show. It helps spread this wonderful, important wisdom for everyone looking to increase their health and well-being. But thanks again, Gary. Let's talk soon. Catch you later.